Hello everyone, I am Dr. Prachi Kulkarni, Fertility Specialist, Ferty9 Fertility Center. Today I am going to talk about how to increase the success rate of an IVF cycle. So when talking about an IVF cycle success rate, there are many factors which are involved. Some factors are related to your physical health, some factors are related to your mental health, some factors related to the IVF center which you choose for your treatment, some factors are related to the advanced technologies or anything extra treatments which are required to increase the chances, and lastly to improve the embryo quality and the uterine conditions to affect your success. So now coming to the first point, which is physical health. So what should you do to improve your physical health? First of all, you have to get your medical conditions under control. If you have any condition like diabetes or blood pressure or hypercholesterolemia or thyroid, you have to take the medicines on time and meet your doctor, consult your doctor, get the dosage revised so that you start your IVF journey at your maximum health. So that is the first thing, getting your medical conditions under control. Second thing is having a healthy lifestyle, having a healthy diet, which includes lots of fresh fruits and vegetables, good protein content, and keep yourself hydrated properly. Have regular exercise regime, avoid smoking, avoid drinking alcohol, avoid all those things which may affect your sleeping or your other health conditions. Exercise regularly, drink lots of water. So all those things will affect your physical health and improve your physical health if you do it at least few months before starting your IVF cycle. Also, now coming to the medicine part, take your medicines on time. Most of the times your doctor will prescribe you the medications which are either in the form of some multivitamins and antioxidants to help and improve your egg and sperm quality. Sometimes there might be some hormonal medications. So taking these medications as prescribed by the doctor on time will definitely help you get good success rate in the IVF cycle. So you should do all this at least 1 or 2 months prior to starting your IVF journey. So this is about your physical health. Now coming to your mental health. Starting with a positive mindset is very important. So go with a positive mindset, understand the process completely, ask your questions to the doctors, understand your specific success rate of an IVF cycle, to try other things like, going for some walks or meditation or breathing exercises to reduce your stress, listen to music, all the things which will help you relax or help you reduce your stress levels will definitely help you in your IVF cycle. So stress, how it affects an IVF cycle is after a stressful condition or after a stressful situation, your body has some hormones which are called cortisol. The levels of cortisols, when they rise, they adversely affect your other hormones also. They affect your blood pressure, they affect your sugar levels. So any level of stress which is beyond particular point is going to affect your cycle badly. So have a positive mindset, understand your condition, understand the issues, take your medicines properly, and keep a very healthy attitude towards your treatment. Then coming to the third point, which is related to the IVF center which you choose for your treatment. So you have to choose your IVF center very wisely, because if the center is well established and a reputed center where the success rate of IVF cycle is good. You may have some friends or family members who have done an IVF cycle. If you know that some of them have done from a particular center and they have got good results without much complications, then definitely you should consider that center for your treatment. Also, you have to look for the doctor's qualification, experience, expertise, skills, the embryologist qualification, and their expertise. So select a center with reputation, with proven success rate, and with good qualified, experienced, skilled doctors and embryologists. Now coming to the point where sometimes the patients hesitate to choose between when it comes to the financial aspect. So do not blindly choose a center or IVF packages which offer the lesser cost, because as you know that all the services where the cost is the least or on the lower side, definitely to some extent the product or the services are not up to the mark or compromised. And here you are not buying an IVF cycle. Actually, your aim should be to have a healthy baby at the end of 9 months with a successful and safe IVF cycle. So success and safety will definitely come at a little higher cost, which may mean that using injections which are recombinant injections which are of good quality, or using the technologies in the lab which are more advanced, like choosing to go for centers who have RI witness system to prevent gamete mixings, or the centers who have alarm systems in their incubators in their lab, so that your embryos or your gametes like eggs and sperms are very safely maintained. So these things also are going to cost something to the center, which ultimately may result in the cost of the IVF cycle. Also, there are many other things which also increases the cost of IVF cycle. Like sometimes there might be some added technologies which are used, like sperm selection technique, or doing some extra procedure to get the sperm. So these things can also cost a little higher. But whatever your doctors suggest, you have to understand properly why this is being suggested and how it is going to change your success rate, and how it can give you better success rate with use of technology, or with use of better quality drugs, so that you have success in single IVF cycle with a healthy baby in the hand and no complications. So safety and no complications with a healthy baby in the hand should be the aim of the IVF treatment, and just the cost of IVF treatment should not be a deciding point. As I mentioned about advanced technologies, so I will just brief about the advanced technologies which can also increase the success rate in IVF. So there's something called as laser assisted hatching, which is used in women who are little older, to help in embryo hatching, so that the implantation rates are improved. Laser actually is also used for doing embryo biopsy, which we do for pre-implantation genetic testing techniques, which are mainly used in patients who have multiple IVF failure, or patients who are more than 35 years of age, or patients who have recurrent miscarriages. So what we do is, there is a blastocyst stage embryo which we biopsy with the help of laser, and we analyze the genetics of the embryo to find out a genetically normal embryo. So this is called PGTA. So this is also an advanced technique which increases the success rate of an IVF cycle by transferring a euploid, means genetically normal embryo. So there are other techniques also to improve the success rate, such as ERA, which is endometrial receptivity assay. Somebody who has recurrent IVF failure, what we do is, we give the medications to prepare the lining of the uterus. We start the progesterone as we start in the transfer cycle. And what we do is, instead of doing the embryo transfer on the day when we are supposed to do embryo transfer, we take the biopsy of the endometrium. We don't do transfer in that cycle. That biopsy is then processed in the lab, and we get the result to know which time period would be best to do the embryo transfer to improve your success rate. So this is another technology which also increases the IVF success rate. There are other techniques which may, like sperm selection techniques like MAX, which is magnetic assisted cell sorting, or microfluidics technique to select good quality sperm for injecting into the egg. If we have good quality egg and good quality sperm, then definitely the quality of embryo will be improved and the success rate will be improved. So this is about the advanced technology. Sometimes some surgeries are also required to improve your success rate. Like somebody has multiple uterine fibroids, or somebody has a submucous, means the fibroid which is going inside the uterine cavity where implantation happens. So such patients are suggested to undergo a surgery to remove those fibroids before embryo transfer. Also, patients who have fluid in their fallopian tubes, which is called as hydrosalpinx, those patients are suggested to undergo a clipping procedure or delinking procedure for the fallopian tubes before embryo transfer. So these are some surgeries which are done to improve the success rate. Also, now coming to the uterus and embryo. So about the embryo, to improve the embryo quality, we have to work on the egg and sperm quality. So we have to work on the medical conditions of the lady and the man whose egg and sperm we are going to use. So getting your medical conditions under control, taking multivitamins, antioxidants should help in the quality. Also selecting the sperms for IVF or sperms for ICSI will improve the embryo quality. Regarding the embryo, again, as I mentioned before, we can also consider going for PGT testing of the embryo, so that the chances of implantation of a euploid embryo are more. So which if we select that embryo, the chances will improve. Coming to the uterus, there are many things which are in the uterus, like there might be fibroids, as I mentioned earlier. Like similar to fibroid, there's other type of swelling which is called as adenomyosis. So this adenomyosis sometimes is surgically removed, most of the times, but this is treated with injections. These injections are actually gonadotropin depot injections, which are like glupride or zoladex depot, which help in reducing the size of the swelling. So these injections are given prior to the embryo transfer cycle. So these are the multiple ways where we take care of the uterine factors. Also, the lining of the uterus, which is the endometrium, is very important. Endometrial thickness between 8 to 12 mm is considered as very good for implantation. So our aim is to achieve endometrial thickness more than 8 mm, and it's between 8 to 12 mm. So we do it with different ways, giving the estrogen in different forms. Or what we can do is, if somebody's lining is on very thin side, then what we do is we may advise to undergo hysteroscopy and sometimes with subendometrial PRP injections to improve the endometrial thickness. There might be sometimes adhesions inside the endometrial cavity. So such patients are also advised to undergo hysteroscopic adhesiolysis before going for embryo transfer. Other endometrial things which may affect can be endometrial polyp, which needs polypectomy. If some patients have uterine septum and history of multiple miscarriages or preterm delivery, then those patients are advised to undergo septum resections. So these are multiple uterine conditions which we need to take care before embryo transfer. So these are the factors which may affect your success rate, and these are the things what we can offer or what you can do as a patient to improve your success rate. Thank you.